Hi, I'm Molly with Empty Hammock, and today I just wanted to talk to you about not having health insurance. It's not that we can't pay for health care, it's that we've opted out of the system. And really, this shouldn't surprise you very much because we're kind of weird. Woohoo! So, a little over a year ago, Barry wanted to become self-employed, and in the United States, this usually means that you need to find private insurance. It's going to be some kind of big change. We would normally have two options, being as our income is not very high. We would either sign up for corporate provided health insurance that was subsidized with taxpayer money. That doesn't sit well with us at all because we don't like that structure of corporate handouts. On the other hand, we could get dumped onto Medicaid. That would not be a good plan for us either. So I started doing some research and I found that there are 4 ministries that are Obamacare exempted because they existed before the law became effective. And Christians can still sign up for these ministries. There's tens of thousands of participating households. And I did some research and I chose the one that seemed the most right for us. They all cost different amounts. They all work a slightly different way. But essentially what it is that Christians are supposed to share one another's burdens, and we're just loosely agreeing that by paying a certain amount to other people each month that we're members and that we can share our own needs if we ever have any. The one I settled on was Samaritans, and we have been sending our share every month to another member. And I know that sounds really strange. The people who have medical needs, they have submitted them to the ministry, and the ministry assigns people to send their monthly money directly to another person. And what this helps us to do is to cut out some of the costs and middlemen associated with that. But also, I can write a letter to the person that had the need and just try and encourage them along with sending the financial help. And I just think that is cool, and it's uplifting where when you're sending money to a huge corporation every month to provide medical insurance, you're just hoping that you're going to get more out of it during the year than you have to pay in. And you know that these CEOs and their bureaucracy is sucking up most of the money that should be paying to help people. At this point, I thought that I was going to be able to tell you how it worked to be on the receiving end of the financial help through this ministry, but it didn't quite work out that way. Last month, Barry had some expensive medical testing. The first step in the process of working out how much the hospital is actually going to be paid is first submitting to the hospital your financial information so that if they can give you a discount, they will do that. The particular hospital system that we went to is a nonprofit charitable organization, so they have a pretty standard process for everybody. So I gathered all of our tax information, all of our my pay stubs, some of his, just everything I could find, and we faxed it off to their office and waited and waited for them to do their number crunching. And when it came back to us, the news was that we didn't owe them anything. So I didn't have a bill to share, which was good news because that means that the finances that are shared among the ministry can go to somebody else that is responsible for a large amount of money. but it means that we're poorer than I ever thought. Because the hospital is a nonprofit organization, they write off a certain amount of care every year in order to keep their nonprofit status. So as part of that, we were given the cost of their care, essentially. If it would be helpful to any of you for me to go over the different ministries and how they're different and why I chose Samaritans over the other ones, but that it might not necessarily be the one for you, I would be happy to do that. So let me know if that would be helpful to anybody. Otherwise, thank you for watching. Have a great... whatever this is, they might be watching like 3 o'clock in the morning. Otherwise, thank you for watching, and I hope this was helpful to somebody.